Welcome back to The Explainer. Today, we're tackling something absolutely crucial. Exactly why and how physical therapy needs to be uniquely adapted for the aging female body. If you've ever felt like a standard workout or rehab routine just kind of missed the mark for you, or maybe for someone you care about, you are definitely not alone. So let's jump right into the science of adapting movement for true longevity. So let's kick things off with a pretty wild question. Could the standard routines that are actually supposed to heal you be doing more harm than good? Well, honestly, yeah, sometimes they are. An aging body goes through some very specific physiological changes, and taking a generic one-size-fits-all approach to physio can actually be completely counterproductive or even dangerous. To really get why this happens, we first have to talk about the underlying physiological shifts going on in the aging female body. Because here's the thing, you can't just slap a generic solution onto a highly specific changing system. We're talking about massive hormonal shifts from menopause. This can trigger accelerated bone density loss, like up to 20% of a woman's bone loss happens right in these stages. Plus, we start seeing increased joint laxity. All of this means the body responds totally differently to physical stress than it did, say, 20 years ago.
And you've probably heard of sarcopenia, right? It's that natural age-related drop in muscle mass. But this is literally a game changer for rehab. If you're naturally losing muscle year over year, jumping straight into a standard resistance training protocol, that's just a recipe for joint strain, not actual strength.
So, because the baseline is shifting, the day one clinical assessment has to shift right along with it. We really need to prioritize osteoporosis risk out of the gate. That means looking closely at DEXA scans, which check bone density, and we absolutely have to do fall risk screening with specific tools like the Berg Balance Scale. We have to know exactly what the baseline is before taking a single step forward. All right, moving right along, all of this initial testing leads us to our next major priority, which is protecting fragile bone health. Now, this is where it gets super practical. If osteoporosis is in the picture, traditional spinal flexion exercises, think your standard crunches or reaching down to touch your toes, those are completely off the table. Why? Because bending forward like that puts uneven pressure on weakened vertebrae, and that significantly raises your risk for compression fractures. Instead, we pivot. We substitute with extension-dominant core work and targeted hip strengthening. It protects the spine while still building that essential core power. But, we still have to build armor around those bones. So how do we pull that off safely? We ditch the high-impact pounding of jumping or running and swap it for low-impact weight-bearing activities. Think brisk walking or modified stepping. It gives your bones the mechanical wake-up call they desperately need to keep their density, without the dangerous force that causes breaks. Transitioning from the skeletal structure, we really need to look at another foundational piece that often gets totally ignored, the pelvic floor. Pelvic floor dysfunction is incredibly common postmenopause. Millions of women are dealing with this silently. But integrating pelvic floor rehab for things like stress incontinence or prolapse prevention, it's non-negotiable. Your pelvic floor is the literal floor of your core. If it's not healthy and stable, the rest of your physical therapy is going to struggle to succeed. It profoundly impacts your core stability and just your overall quality of life. Now that we've got a stable foundation with the bones and the pelvic floor, we can start talking about building muscle through smart resistance training. Here is the key takeaway. When we adapt resistance training for this demographic, progression has to be much, much more gradual. Initially, you should be lifting at just 40 to 60% of your 1-rep max. We are not ego lifting to failure here. It's all about gently coaxing the muscle to grow without overwhelming those recovering joints. And equally important, maybe even more important, is extending those rest periods between sets to about 90 to 120 seconds. I know it feels like a long time to just stand there, but as we age, our neuromuscular recovery just slows down. Your nervous system literally needs that minute or two to reset. Rushing through rests is exactly how form breaks down and injuries happen. So it's really a calculated formula, right? Start at that lower 40 to 60% intensity, take those longer rests, and really focus heavily on multi-joint functional movements. We want to train your body to move as one coordinated unit, rather than just isolating a bicep on a seated gym machine. And naturally, we assess frequently to make sure the program is perfectly dialed in. Oh, and if we're dealing with arthritic joints, we adopt even further. We bring in thermotherapy, basically applying strategic heat beforehand to prep the tissues. We stick to joint-friendly ranges of motion, and generally, we keep the overall repetition dosage lower than we would for a younger person. It's about working smarter, for sure, not harder. Which brings us to the final, and honestly, the most rewarding piece of this whole puzzle, mastering daily functional activities.
Because let's be real, the true measure of success here isn't some arbitrary gym stat like your bench press. It's about regaining your total, unbothered independence. We want you carrying all the groceries from the car in one trip, without pain. We want you climbing stairs smoothly, without feeling winded or terrified of falling. This is where physical therapy meets real life.
And we can't overlook the psychosocial side of things either. Participating in tailored, group-based sessions with peers who actually get what you're going through, it's a massive boost for program adherence. Plus, it's just a really great way to tackle social isolation head-on while hitting your health goals. So, as we wrap up this explainer, I want you to remember that these modifications, whether it's protecting bone density or engaging the pelvic floor, they are not limitations. They are your actual blueprint for longevity. So, what steps are you going to take today to implement these smarter strategies and confidently master your daily life? I'd highly encourage you to bring these approaches up with your physical therapist. Thanks for hanging out with us, and we'll see you next time.